Hi, I'm Dr. Stephen Smith with Start My Practice. Today I want to talk about one of the most important mindset shifts you'll make in independent practice. Sell services, not time. How most physicians are trained to think. In traditional medicine, we sell time. A patient comes in, you bill a 99213, a 99214, a new patient 99215. That's the model we trained in, and that's what most of us default to when we open our own practice. But that model doesn't work in functional medicine, regenerative medicine, anti-aging, or any service-based practice where the patient is coming to you for a result, not just a visit. Let me give you a real example. We ran an LDA program, low-dose antigen therapy for allergies. It works extremely well, but it works over time. After the first treatment, maybe 50% of patients noticed any improvement. After the second shot, most were feeling results. By the third shot, most were off their antihistamines. And by the time they'd completed 6 to 10 treatments, they'd essentially forgotten they had allergies. 90% fully controlled with no medications. Now, if you charge per visit at $250 a shot, a lot of patients are going to quit after the first treatment because they didn't feel anything. They paid $250, got no result, and they're done. You failed them. Not because the treatment doesn't work, but because the pricing model set them up to quit before it could work. The right way to price it, charge for the outcome. A full allergy treatment series is $1,000, $2,200, whatever your market supports. They're buying the result, allergy relief, not individual injections. That framing keeps them committed through the process, and it means you get paid appropriately for the full course of care. This applies across your service lines. The same logic applies to weight loss. Patients come to you because they want to lose weight. Charge them for a weight loss program, not per visit. If something isn't working along the way, your team digs in and figures out why. That's part of what they paid for. It applies to Prolozone injections for joint pain. The first treatment rarely produces dramatic results. By 3 treatments, most patients are getting meaningful pain relief, and by 6 treatments, they're doing very well, especially with stem cells or other regenerative additives. Price it as a series. The real advantage, you get paid while your staff works. Here's where the model gets powerful. Once you've built out your service lines and trained your staff, many of these treatments don't require you in the room. LDA shots, weight loss follow-ups, IV therapy, injection prep, your staff handles it. You've already collected for the series. Your team is treating patients and generating revenue while you're seeing complex cases, doing consultations, or simply not running room to room all day. That's the model. Get paid for results, not for your time. I'm Dr. Stephen Smith. I'll see you in the next video.